Cases of monkeypox are rising across the country, and people are having trouble right now getting the vaccine.
It's like the Hunger Games. Trying to get online and actually you have to be there with multiple tabs open. It was a hassle and it was a pain.
Yeah, I had the time to sit there and refresh it for other friends, but not everyone can do that.
How long would you say it took you to get?
Over an hour.
New York City has about 1/3 of the nation's 1,500 monkeypox cases, yet the city has only received about 10% of the vaccine doses they need. Tonight, Washington, D.C. reported 122 cases of the virus, the highest number of cases per capita in the country. And vaccine clinics have also opened there, but they are dealing with supply issues as well. On Friday, the Department of Human Services ordered an additional 2.5 million doses, but they won't get here for several more months. Dr. Susan Bleasdale is the Chief Quality Officer for the University of Illinois Hospital, joining us live tonight. Doctor, appreciate your time. The former FDA Commissioner, Dr. Scott Gottlieb, said that the window to get monkeypox under control and contained has closed. Is that true?
I don't know if it's closed, but I think it's important that we have to get information out and we have to make sure we're getting it to the right groups and people know what to do with this. This is different than what we've had with COVID, but it still needs a rigorous public health and health systems response.
Should we be offering more access to testing right now? Is that the biggest issue, and then the vaccine?
Well, testing is really important so that people know when they have monkeypox so they can limit the additional exposures. But I think what's different is when we responded to COVID, we expanded a lot of testing without any connections to care. I think it's really important that people get connected to their providers, that get evaluated for a rash, because the rash can be several things. For a while, when we had COVID, it pretty much was only COVID that was circulating. With monkeypox, it could be something else like chickenpox or like herpes or another virus, and you really need to see a provider. They have expanded testing, which is great. We have testing at, I think, up to 5 different commercial laboratories right now. So if you get to a provider, you can get guidance on what to do, get tested. You don't need to come into the hospital to do that. You just need to talk to a doctor and make sure that you know what to do. And it's basically, if you are waiting for the diagnosis of monkeypox, it is to isolate yourself, to refrain from activities where it can be transmitted, which in particular, it's that close contact, intimate contact and skin to skin that is leading to transmission.
Let's talk about the vaccine for a moment and some of these long lines we're seeing, access to the vaccine, supply and demand issues. What are your thoughts on where we stand right now and where we could be doing better?
Well, I think the long line says that we are getting the message out to populations that need the vaccine, which is important, but we do need to get more vaccine. And so it's really trying to target vaccine to the areas where we've got higher transmission, like you highlighted, in those states that have the highest numbers, because what we're seeing is monkeypox is spreading in these social networks in those areas. Sometimes that's expanded because of travel across to other states, but we do know that there's some high risk areas that we need to focus much of the vaccine availability. This is similar to just where we were with COVID, in that it takes a while to get the availability, the vaccine, and then the accessibility. But partnering with health systems and departments of public health will help to get more people what they need, and having scheduling options that I think help to eliminate some of these long lines, especially similar to what we saw related to COVID-19.
Real quickly, monkeypox has been around for a long time. We already have the vaccine for it. What's the potential for this type of illness to spread and get worse? I know I'm asking you to look into the crystal ball a little bit, but what do we know?
Well, anyone can get monkeypox, but it is spread by close contact. So it is typically that skin to skin contact. It is those that can spread it in kissing, cuddling, sharing a bed, or sexual contact. Right now, it is in some networks of social networks of where people are transmitting it. And some of the issues of where it has been transmitted is that there can be some spread when you're not aware that they have the rash. And it is in some networks of anonymous sexual activity. So you can't follow up and say, I've developed a rash and let someone know. So it's really important for those people that are involved in that sort of activity are aware to get vaccinated. But in general, I think that it's not spread the same way as COVID-19. It's an important public health issue that we need to get the right information out there and get access to testing and vaccination. But it is not going to be at the same scale that we saw with COVID-19.
All right.
So I think that's important.
That's the silver lining. All right, Dr. Susan Blesdale, I appreciate your time tonight. Thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.